All right, well, we can go ahead and get started. So welcome to the April webinar. So today we have a few things about LAMP and then a presentation from Mayo Clinic by Laura Harper. So we'll get right into the boring stuff so we can hear the presentation. So first up is some major UI changes. So when you enter the dashboard, this will be after a release, hopefully coming sometime next week. You'll see that things look a little bit different. The dashboard will function the same way. It'll just be a little bit easier to navigate, hopefully, as well as offer some opportunities to customize things like sensors and studies. So here's just an example of the activities tab. And then as you can see, we'll also now have a studies tab and a sensors tab. Any questions about this? Great. Next up, there are some sensor updates. So last month I mentioned that we had an update coming where clinicians or researchers would be able to toggle on and off which sensors are being used for each patient. So maybe one patient is uncomfortable with having their GPS data gathered, but another's okay. Now you'll be able to decide who is getting data and who is not. Additionally, we have updated our documentation another time this way to make it more collaborative. So it is on GitHub now, and this will be in place pretty sure by the end of this week, if not early next week, implemented. But feel free to make some pull requests, edit something if it's not making sense, or as always, reach out to us and we can make those changes. But definitely check out the new documentation. Some feedback on it is always welcome. And then finally, we have been working very hard to work on the UI updates as well as the sensor updates. So some bugs have kind of queued up. We'll be working on those as soon as this new update is released, but please continue to submit bugs because it is very helpful for us to be able to make LAMP better for everyone. Any questions about LAMP before we move on to Laura's presentation?
Yeah, just a quick question. For these changes, do we need to update the back end as well, or these are just the app and these are just purely on the UI side?
Purely on the UI side, you should not need to update anything on your end.
Okay, thank you.
Yeah. Well, with that, I will stop sharing and I will pass it over to Laura.
Thank you. 1 second here. Okay, can everyone see that?
Yeah.
Okay, perfect. So thanks for having me. My name is Laura. I'm the study coordinator for the MindLAMP study that's being done at Mayo Clinic. And the title of our study is Feasibility of Smartphone App MindLAMP in Developing Digital Phenotypes in Depression. The purpose of our protocol is just to assess the feasibility and acceptability of the PASA data collection through smartphones in depressed patients, and see how that data that's gathered through the technology platforms can pretty much gather information and see if that can inform the assessment and or treatment outcome of major mood disorders. So in this case, such as major depression and bipolar disorder. A little bit of background. So it has been found that the use of smartphone apps and sensors embedded into current care models can help conventional mental health care. And this can be done because the MindLAMP app will allow participants to take those PHQ-9 and GAD-7 questionnaires up to 3 times a week, rather than when they only come in for an office visit. So getting that information more often. And we will also collect different physiological data such as step count, heart rate, activity levels, GPS, and sleep activity. And the smartwatches that will be provided by us as a study team. And it also will allow participants to complete the different cognitive tests on the app and to help manage their symptoms by being able to look at their data as well. The target accrual that we're looking for, we would like at least 300 patients. 50 of those would be bipolar 1, 50 bipolar 2, 100 major depressive patients, and then 100 healthy controls. And the healthy controls would just be to ensure that those biomarkers are specific to mental health rather than just regular variations. And for the subject population for our study, we're just recruiting patients that are seeking treatment from the Depression Center here at Mayo Clinic and integrated behavioral health. Study participation for this study will last about 3 months. That would include 4 in-person visits. And at each of those visits, we would download the data that participants have been getting or collecting. And they would also take some scales as well. We would do some psychological scales at that time. And basically kind of compare everything that we've been collecting up to that point. And if participants do complete the entire study, they are offered the watch for free. We also are giving them about $25 for each visit. And this is kind of just kind of a diagram that's showing what kind of data we'll be collecting throughout the study. So there'll be 30 days in between each visit. And it'll just list all the different scales that we'll be doing. And then at the bottom, of course, we'll be having them do the cognitive test, the passive data that's always collected, and then those symptom surveys that they'll be doing 3 times a week. And then here's just kind of an overview of the inclusion criteria for a study. We're looking for patients from ages 18 to 65 and with patients that are seeking treatment. And they, of course, have to have a compatible smartphone. And then for the healthy controls, we're looking for the same age and then age and sex matched controls with a smartphone as well. And then for exclusion criteria, they of course have to understand English. They of course have to provide written informed consent. They can't be looking for treatment unrelated to depression. If they have psychotic disorder or history of psychotic features, they can't participate, or active suicidal ideation. And then women with known pregnancy at the time of enrollment. And then for healthy controls, they just have to understand English, informed consent, and women with known pregnancy. All right, and then, of course, the principal investigator of the study is Dr. Fry at the Mood Center, and then Dr. Scott Breitinger, which he works in the integrated behavioral health.
Great, thank you, Laura. This is awesome. Does anyone have any questions? Well, I have a question around recruitment. Any challenges you faced around finding patients? I imagine the healthy controls is fairly straightforward, but it seems like seeking depressive patients might prove more difficult.
Yeah, we actually haven't started recruiting yet. So we're hoping to start recruiting healthy controls first, just so we can make sure everything's well put together and we have a good workflow going on. So we're prepared for depressive patients. So we're going to hopefully start that soon. We're just trying to get some things fixed before we start recruiting. So.
Yeah, it makes sense.
Any other questions?
Can you say a little bit more, Laura, about the wearable that you guys picked, or
Yeah.
there's many of them out there, but like the story of the wearable?
Yeah. So we were at first we were gonna we had some at Mayo that we were gonna use. They were actigraphs, I believe, but we didn't think that would work. So we just bought 2 different brands off of Amazon for the wearable watches. One is Willful, it's called, and then the other one is Let's Calm. And they're just Android watches, so they're not expensive by any means. They're about $40 each. So hopefully that works okay. They're probably not as great as the Apple watches, but hopefully they'll get the job done. So.
So can I ask Laura about your technology? Are you hosting LAMP internally, or are you using Amazon or Azure?
Yeah, it's going to be internal. Yeah, so our IT team put it on our server. I don't know a lot about it, but I just know that. So.
And it's been tested with Android only, or you've done some iPhones?
So yeah, it only works with iPhones right now. So we're trying to have it work with Android. So that's kind of one of the things that we're waiting on before we start recruiting.
Okay, thank you.
Does anyone else have any more questions for Laura? All right, well, then that is it for today. Thank you everyone for joining, and we will see you next month. Thank you again, Laura. That was wonderful. And I hope everyone has a great weekend.